You wake up in the morning. You sit on the edge of your bed. As you take that very first step onto the floor, you feel a sharp, tearing pain in your heel. It feels exactly as if you just stepped on a sharp stone or a piece of shattered glass. If this sounds familiar, please know that you are not alone. That agonizing morning pain is the ultimate hallmark of one of the most frustrating, stubborn, and widely misunderstood orthopedic conditions, plantar fasciitis. So many people try to push through the pain, hoping it will just magically disappear as the day goes on, only to find it waiting for them the very next morning. I am Dr. Matthew Rhodes, and in today's episode of REHAB MD Insights, we are going to deconstruct exactly what is happening deep inside your foot, why standard treatments so often fail, and what the science-based rehabilitation plan looks like to get you walking pain-free again. Let's get into it. To understand how to treat this debilitating pain, we first need to visualize the incredible engineering of your foot. Imagine the bony structure of your foot as a traditional wooden bow, the kind used to shoot arrows. The plantar fascia is the thick, dense, fibrous bowstring. It anchors securely at the main heel bone, known as the calcaneus, and fans out to attach at the base of your toes. The function of this fibrous band isn't just to passively hold your arch up. It acts as a highly dynamic spring and a shock absorber every single time you walk, run, or jump. The classic symptom? That piercing, stabbing pain at the bottom of the heel, which is notoriously worse during your first steps in the morning, or when you stand up after sitting for long periods at your desk. As you walk around during the day, the pain often fades into a dull ache because the tissue warms up and stretches slightly. But as soon as you rest, the cycle resets. But what exactly is causing this relentless cycle of pain? Historically, the suffix itis in the word fasciitis implied that this was an inflammatory condition. However, modern medical science and tissue biopsies show us a very different reality. In many chronic cases, the condition behaves less like a purely inflammatory disorder and more like a degenerative overload injury. We are dealing with a fasciosis, a chronic degeneration and wearing down of the tissue. The biomechanical causes are incredibly varied. Flat feet, excessively high arches, chronically tight calf muscles, a sudden spike in running mileage, obesity, or simply standing for hours in unsupportive footwear on hard, unforgiving surfaces. The end result is always the same: mechanical overload. The good news is that you rarely need surgery to fix this. Your first line of defense begins today, right in your own living room. The goal is twofold. We need to restore flexibility to the fascia, and we need to build strength in the intrinsic muscles of the foot. Let's break down a conservative, science-backed protocol you can start right now. Number 1, the ice bottle roll. Freeze a standard plastic water bottle. Sit down comfortably, place the frozen bottle under the arch of your foot, and roll it slowly from the heel to the base of the toes for about 10 minutes. The cylindrical shape perfectly stretches the arch, while the profound cold provides a powerful analgesic effect to numb the pain and helps reduce pain sensitivity and local irritation. Number 2, deep friction massage and myofascial release. Using a dense lacrosse ball, a firm tennis ball, or your own hands, apply your body weight over the ball, targeting the tightest areas of your arch. However, strictly avoid pressing directly onto the acutely painful spot on the heel bone itself. Move your foot in slow, small circles. If you find a tight knot, maintain steady, continuous pressure for 30 seconds to help release the bound-up fascia. Number 3, the posterior chain stretch. Your plantar fascia doesn't work in isolation. It is biomechanically linked to your Achilles tendon, which connects to your calf muscles, the gastrocnemius and the soleus. If your calves are tight, they constantly pull up on the heel, dramatically increasing tension on the plantar fascia. Stand facing a wall, step the affected foot back, keeping the heel firmly planted and the knee locked straight. Lean forward until you feel a deep stretch. Hold for 30 seconds. Then, slightly bend that back knee to shift the stretch deep into the soleus muscle. Most patients will experience significant improvement using these conservative strategies over a period of weeks to months. However, self-diagnosis has strict limits. There are clinical red flags that demand immediate professional evaluation. If you begin to experience numbness, tingling, or a pins and needles sensation in your foot, or if the pain genuinely wakes you up from a deep sleep, stop. These are not typical symptoms of plantar fasciitis. They can indicate nerve entrapment, such as tarsal tunnel syndrome, or even a bone stress fracture. For any severe, unrelenting pain that does not respond to rest, you must seek a professional assessment. So who should you see? Consulting a medical specialist, specifically a physiatrist, who specializes in physical medicine and rehabilitation, PM&R, or an orthopedic surgeon, completely changes the game. In the modern clinic, musculoskeletal ultrasound is one of the most valuable modern tools for confirming the diagnosis and assessing tissue quality in real time. This allows the physician to visualize your plantar fascia in real time. They can measure its exact thickness, grade the level of tissue degeneration, and definitively rule out any complete tears. Ultrasound removes all the guesswork. If conservative home treatments fail, these specialists offer highly advanced, minimally invasive interventions. Extracorporeal shockwave therapy, ESWT. By delivering high-energy acoustic sound waves directly into the damaged fascia, this treatment creates controlled microtrauma. The goal? To stimulate a biological healing response, triggering the growth of brand new blood vessels in a chronically degenerated area. Ultrasound-guided injections. For severely debilitating acute pain, a physician might utilize a precisely guided corticosteroid injection for rapid relief. But repeated corticosteroid injections should be used cautiously due to potential risks, including fascia weakening or fat pad atrophy. However, to promote true long-term tissue regeneration, modern clinics are turning to cutting-edge biologics. Options like PRP, platelet-rich plasma derived from your own blood, or viscosupplementation using hyaluronic acid are showing potential benefit in selected chronic cases, though evidence is still evolving. And crucially, these are always delivered with pinpoint, millimeter accuracy using an ultrasound machine. Healing plantar fasciitis is a marathon, not a sprint. It requires dedication to your daily rehabilitation and, above all, listening to your body's signals. Start with these biomechanical changes at home, but never hesitate to seek the advanced guidance of a physiatrist if the pain simply refuses to fade. If you found this breakdown valuable for your recovery journey, please hit the like button, subscribe to the channel for more premium medical education, and share this video with that friend who complains about their achy feet every single morning. Before we go, I want to be absolutely clear. Please do not skip or delay seeing a doctor just because you watched this video. This content is intended for general educational and informational purposes only, and should not be interpreted as medical advice or used to diagnose or treat any condition. Always seek the guidance of a qualified healthcare professional regarding medical concerns or emergencies. I am Dr. Matthew Rhodes, wishing you a swift journey back to pain-free movement. Take care of yourself, and I will see you in the next video. Please leave a comment, like this video, and subscribe.